We are live. We are live. I'm Dr. Frita, and it is Medical Monday. So you know it's time for me to give you the medicine in the news. And as usual, we have a lot. We're going to start off with medical myth versus fact. I'm going to give you myth versus fact on pink cocaine, which has definitely been in the headlines. And then, of course, I'll give you your weekly dose of the other medical topics that have been in the headlines. We are going to start off with Cardi B. If I see you and now speak. Okay, Cardi B was hospitalized, and so we'll talk about that. And then we'll talk about McDonald's, which has been in the headlines a lot for many reasons. We got folks who are salting fries, but the health concern is that an E. coli strain, yes, an infection, a bacterial infection has been found in some McDonald's food. And so we'll talk about that and how to keep yourself safe. And then we'll talk about Solange Knowles. Solange Knowles, yes, Beyonce's sister, because she has shared that she has multiple medical diagnoses, which explain a lot of the illnesses and some of the canceled performances. And so we'll talk about Solange and her openness with her health journey. And then we'll talk about some of these Real Housewives of Atlanta alums. We'll talk about NeNe Leakes, but really we're talking about her son, her youngest son, Brent, who we've watched grow up. Well, he has actually had a heart transplant. He's only 25. Then we'll talk about Candy Burst because her husband, Todd, had a health scare. He thought he was having a heart attack or a stroke. He's doing okay, but we'll talk about his health scare. And then we'll round it out talking about Oprah, because Oprah is giving you some real deal facts about menopause. Now, don't forget, we will do a quick few questions for a live Q&A afterwards. But then after this live, we'll have our members only live. Well, I'll give you live Q&A the entire time. Go ahead and like and subscribe as you come into this channel, because I'm Dr. Frita, and we're about to have a wonderful Medical Monday. Hello, hello. All right, I'm Dr. Frita. We're about to have our Medical Monday here. Go ahead and like as you come on in here and share this video. I'm going to give you some wonderful evidence-based information, but I'm not going to do it alone. Where's my co-host and my practice manager, Shador? Come on up to the stage. How are you doing, Shador?
Hey, Dr. Frita, I'm making it. How are you?
You're making it. Yeah, a lot of folks are making it. You know, we're in the season. It's flu season. It's the C19 season. It's the pneumonia season. And so for anyone who has little kids or just people who are at work, be careful because we got bugs going around. Consult with your doctors and make sure you get your flu shot or your C19 shot or your pneumonia shot. So even your shingle shots if it's indicated. Yeah, we had a pretty busy weekend over here. We did some traveling because my youngest daughter, Avery, who you know, she's my 14-year-old daughter, who's my height. She's almost my height. She's 5'10". I still got her by a little bit. But she went to Charlotte, North Carolina, where she was invited to do a basketball workshop showcase. They interviewed her. Check out my Instagram channel at dr.frita, and I show some of her highlights in her interview. I was pretty proud of her. She did quite well. She did quite well. And then, all the regular usual stuff running around. But you know what? Now it's time to run into these hot topics because we have a lot to talk about. And I want to start off talking about myth versus fact for pink cocaine. So I'm going to go ahead and ask that we roll a clip. But first, I want to see who's the first person in the chat today.
First person today, we have Russell. Hello, Russell.
Hi, Russell. Yay. Thank you for supporting us, Russell. We're about to have a good old time. Okay, but as we get ready to roll this first clip about pink cocaine, because there are a lot of myths versus facts going on, I want to ask and see what the folks in our chat think about my first myth versus fact question. Pink cocaine actually has cocaine in it most of the time. Put M1 as in myth 1 if you think that's a myth. Put F1 as in fact 1 if you think it's a fact. So the question is, the myth or the fact is, pink cocaine usually has cocaine in it. M1 if you think that's a myth, F1 if you think it's a fact. Now let's hear what Lamar Odom, who apparently knows a little something about pink cocaine, has to say about it.
Tootsie, what they call all that.
Oh, really?
Yeah.
Have you ever used that?
Think so.
Yeah.
I've done a lot of things.
Okay.
I'm not ashamed of because it's my testimony.
He had crack in his system.
Crack. He was really scoring. Where was he at?
He was in Argentina.
Wow.
So he had some sort of crystal meth, Argentina's version of crystal meth. He had crack, pink cocaine.
Did he have he had a drug problem? Obviously.
Yes. Yeah. He said he was sober, but a lot of. So basically, like the way that he came to his fatal death, people aren't sure if he fell because of the drugs that he was on. What kind of experience have you had with crack and like pink cocaine?
Drugs could cause you to hallucinate.
Yeah.
And if he was in a hallucination state, then who knows what would happen.
Has that happened to you? Have you experienced that?
I've heard voices before.
Okay.
Yeah, that's about it.
Have you ever gotten a sense of paranoia or anything like that? Or people chasing you?
Yeah.
Could you understand?
Especially with the unforbidden, which is crack.
Yeah,
that could really drive you up a wall.
Could you sort of see how those drugs in his system might lead him to a fall like that?
I mean, to death, I don't know, because I was always strong enough to kind of like bear down. Some people realize that there's no exception to not being here.
Yeah.
You know what I'm saying?
Yeah.
So I'm gonna make sure I say a prayer for his family and everyone that he knows.
I guess for people that don't understand, could you sort of describe that state of mind that you're in when you're?
Well, I mean, if you're hearing voices, then it's hard to escape.
Yeah.
Those voices. So God forbid if those voices told him to do something that led to his fate.
Yeah.
That'd be a shame.
Is there any positive light in all of this?
I think not to do drugs.
Yeah.
Like not to put anything up your nose, because it could have been fentanyl and that shit.
Mm-hmm.
Like who knows? Who wants to get high? I call it getting low.
Yeah.
You know what I'm saying?
Yeah.
This is the only way.
Will this maybe, because a lot of celebrities of your caliber, of his caliber, have a lot of easy access.
Well, I hope this is a wake up call.
Yeah.
For everyone in the industry, Hollywood, music, sports, that drugs don't discriminate, age, race, color, creed. So hopefully this is a wake up call for everyone.
Yeah.
I thought that was pretty powerful, Shador, with it being Lamar Odom, someone who is a celebrity who has been respected in his field of basketball and who's also been very open, because I remember when he really had a life-threatening scare after some of his drug use. And so I thought that it was very heavy coming from someone, right, who's actually done the pink cocaine. He also shed some light, don't you think?
Yeah, absolutely.
Yeah, he also shed some light on what we talked about in last week's live. If y'all didn't see last week's live, go ahead to the replay of the live we did last Monday where we talked about Liam Payne, because he was saying, that Lamar Odom has even experienced hallucinations on the pink cocaine, which I know we were kind of speculating. And I know some people are saying that he, jumped and took his life on purpose, Liam Payne, but now even getting an added perspective that you can have hallucinations on the pink cocaine. And we know that Liam Payne had pink cocaine in his system, then he could have been hallucinating, and it could have been an accidental case of him now no longer being alive. And so I just thought that gave an interesting perspective. All right, Shador. So we'll talk some about pink cocaine. But first I want to know, do people say it's a myth that most pink cocaine actually has cocaine, or that's a fact? Most pink cocaine actually has cocaine. What do we get? What are some responses?
A good mix. So Mary says fact.
Hi, Mary. So you're saying that a fact is that most pink cocaine has cocaine. All right. Who else?
Also, Simona agrees that it is a fact.
Okay. She agrees that pink cocaine actually has cocaine. Well, this is going to be fun today, y'all. Okay.
And Miss Phyllis says fact.
She says a fact.
Mm-hmm.
So they know for a fact that most pink cocaine has cocaine. All right. Who else? Anybody else?
Yes, we have Minister Irma Jean. Hello. Says a myth.
It's a myth. But even though it's called pink cocaine, most of the times it doesn't have cocaine. All right, Minister. What you know, Minister? Okay.
Right. And also Sheree. Hi, Sheree. She says myth.
Hi, Sheree. Welcome back, Sheree. I love it when you join us. So Sheree also says that it's a myth that most pink cocaine actually has cocaine. All right. See, I love y'all, my med heads in the chat. So here is the myth versus fact. It's a myth. Most pink cocaine does not actually have cocaine, despite the name. Now, the reason I said most is because you can always have someone who says they added cocaine in it, but most pink cocaine, by and large, vast majority, the makeup of pink cocaine does not actually have cocaine. The name is quite deceiving. So what the pink cocaine really is it's a mixture of many drugs. There's a polypharmacy. So it has 2CB, which is why it's called Tusi, or Tusi, and it has ketamine, MDMA, also called Molly, and it can have methamphetamines. Now, in some cases, it might have fentanyl added, and yes, in some cases, it might have cocaine, but it's not cocaine that's dyed pink. By and large, it's not. It's a designer drug, and they call it a designer drug. It's less expensive than cocaine, apparently, on the market. So let's talk about some of the components of pink cocaine. And then I want you to answer this next myth or fact about pink cocaine before we move on. Here's the question. Pink cocaine is generally much safer than cocaine. Pink cocaine is generally much safer than cocaine. Of course, there's going to be nuances to these questions. Just like I said, for the first myth versus fact, yes, you're not completely wrong, because there are some people who will add a little cocaine to pink cocaine, but then that makes it expensive. So most pink cocaine does not have pink cocaine. So the next question is, pink cocaine, being a designer drug, is generally safer than just regular cocaine. Put an M2 if you think that's a myth. If you don't think it's generally safer, put an F2 if you think that's a fact. Yeah, this pink cocaine doesn't even really usually have cocaine. It probably is safer. So the question is, pink cocaine is safer generally than regular cocaine. M2 if that's a myth, F2 if that's a fact. Okay, so now let's talk about the makeup of pink cocaine. So I mentioned that it has 2CB or 2C, and that's a hallucinogen, okay, which used to be used actually to treat men's erectile dysfunction, okay? It treated erectile dysfunction. It's now off the market, okay? It's off the market. It's not FDA approved, but people are still using it in pink cocaine, 2CB or 2C, which is really the main component that allows pink cocaine to have its name. But there's also MDMA, also called Molly, also called ecstasy. Okay. And to learn more about Molly, watch my YouTube video here where I talk about Molly. What is Molly? And I go into details about ecstasy, but we do know that Molly or MDMA can have all kinds of issues. It can cause kidney problems. And for those of y'all who are new to my channel, I am Dr. Frita. I'm a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure doctor. So yes, MDMA is something that can cause you to have hyperthermia, meaning your body gets very hot, you get a dry mouth, you have this thirst. It can also cause you to have hallucinations, fast heart rate. It can cause you to pass out, okay, lose consciousness, and it could lead to dehydration and issues with your sodium balance, and it can cause kidney issues. MDMA can. Okay, there's also ketamine, typically in pink cocaine, and we know that ketamine is a dissociative sedative. It can also be used as an animal tranquilizer, FYI, and it can be used as an anesthetic, like anesthesiologists for surgery can use ketamine. And now we see that it has some approval for even treating depression and anxiety. Ketamine does. But what ketamine can do is it can definitely cause you to hallucinate. It can cause some amnesia. It can certainly be sedating. And ketamine is something that's typically in pink cocaine. And then you could have methamphetamines, okay, which we know can be kind of be like an upper, right? And in some cases, people can slip fentanyl in there, one of the synthetic narcotics. And we know that it only takes 2 milligrams of fentanyl for it to be fatal, right? The amount of fentanyl that fits on a pencil tip is enough that can take you out. So that's generally the mix of pink cocaine. And they dye it with food coloring to make it pink. Or in some cases, they even use strawberry flavoring to make it pink. Okay, but it's not just cocaine that's dyed pink. Okay, so did we get anyone else for the second myth or fact? This statement was pink cocaine is generally safer than just doing cocaine. None of it's safe, okay? But relatively speaking, pink cocaine is generally safer than just using cocaine. So M2, if you think, nah, that's a myth. F2, if you think, yeah, it's safer, that's a fact. Do we have any takers?
Yes, so again, a couple mixed reviews. We have Kim says M2. Hi, Kim.
I think it's a myth. It's not safer, even though it's not really cocaine. And it's pink, Kim. It's pink, like cotton candy.
Also, Belinda.
Hi, Belinda. She said it's a myth. She doesn't buy that with it being safer. Okay, who else?
And our facts goes to Avis. Hello.
Avis thinks it's safer. Okay, pink cocaine, because anybody who grew up knowing about if you want to ride the white pony, the nickname for cocaine, or if they've seen Rick James, who said cocaine was a drug. We've seen what cocaine can do to people. All those different movies, Blow and Goodfellas, one of my favorite movies. We know cocaine can cause a lot of problems, right? It can lead to heart attacks, strokes, kidney failure, the works, right? Cocaine can do that. So we know cocaine is a heck of a drug. But the question is, okay, the statement is pink cocaine is safer than cocaine. Okay, so you think that's a fact? Okay, Avis. Anybody else?
Goldie says a fact.
You say it's a fact that is safer. Okay. So myth versus reality. Pink cocaine is safer in general than regular cocaine. That is a myth. Now, let me tell you why. Because as you just heard me saying, with all things cocaine can do, and of course it's going to be dose dependent, there are nuances to it. And cocaine, as Rick James said, is a heck of a drug. However, here's the trick with pink cocaine. It's polypharmacy. It's polypharmacy, meaning you have some portions of the drugs that are uppers, we'll say, causing your body to have a faster heart rate, causing your body to have a high temperature, causing your, sympathetic nervous system to be, keyed up. And then you have, at the same time, with this mixture, you have some drugs that are essentially downers, okay? Like ketamine, drugs that are sedative. So they're telling your body to slow down, right? These things are happening at the same time. And then on top of that, you mix in hallucinogens, which are making you potentially hallucinate, where you can have audio hallucinations where you hear things that aren't there. You might hear someone telling you to go jump or go do something, or they might be telling you to go attack someone, right? Or you have visual hallucinations, right? Where you might think that there's a walkway there that's not. You may think that you're on the first floor and you see clear ground, but really you might be on a third floor balcony. You've got all these drugs at the same time, and it is throwing your system off. So it's the polypharmacy of pink cocaine that makes it highly unpredictable. So pink cocaine in general is not safer than cocaine. Now, I'm not going to say that cocaine is safe because it's not, but I'm just going to say that you can't say that pink cocaine is safer. Ooh, that's fun. Thank y'all for participating. I love when y'all participate. Y'all, please go ahead and like this video and subscribe to our channel. When I last checked, guess what? On the Dr. Frita YouTube channel, we have over 799,000 subscribers. That means we're almost to 800,000 subscribers. Y'all help us go ahead and get to it. Go ahead and share this and tell a friend to tell a friend. Tell them come on and like us. Okay. And also make sure that you check out my Instagram, because if you want to know more about pink cocaine, I did a video that's actually doing very well on my Instagram. I have it pinned at the top. You'll see Puff Daddy. You'll see Diddy up there, because we know that they found pink powder, which, is allegedly pink cocaine when they arrested him. And so I go into more detail about the different substances in pink cocaine. So check out my Instagram at dr.frita. Give me a follow over there, because I have different information, different data, and just more personal stuff going on in my life over there on my Instagram. All right. Well, that was fun. I like playing myth versus fact. All right. So now, Shador, shall we get into the weekly dose?
Yes.
Shall we? Okay. So weekly dose. Here is your medicine in the news. Let's talk about Cardi B. When it's up, then it's up, then it's up. Oh, okay. Cardi B was hospitalized. Okay. Let's see. Let's pull that article up, or if you have a clip on Cardi B, please.
Cardi B reveals she's been hospitalized. 3 days before the rapper was set to take the stage at One Music Fest, Cardi has canceled her performance at the Atlanta Festival due to being hospitalized over a health issue. She says in a message shared to Instagram October 28th, "I am so sad to share this news, but I've been in the hospital recovering from a medical emergency the last couple of days, and I won't be able to perform at One Music Fest." She adds, "It breaks my heart that I won't get to see my fans this weekend, and I really wish I could be there. Party gang, thank you for understanding, and I'll be back better and stronger soon. Don't worry. Love y'all." The 32-year-old doesn't disclose details of the emergency in her message. Following the post, One Music Fest shared their own message in support of the Grammy winner's decision, saying, "Unfortunately, Cardi B announced that she is no longer available to join us this year due to ongoing health issues. Let's all keep her in our prayers for a full recovery. We are working hard to find a replacement at this late date." Along with recovering from a scary health situation, Cardi has gone through a few other major life changes recently. She welcomed her third child with estranged husband Offset back in September, just 1 month after she filed for divorce from the Migos member after 7 years of marriage. And while their breakup hasn't been totally smooth sailing, Cardi, who also shares daughter Culture and son Wave with Offset, has continued to focus on her future as a mom of 3. Cardi wrote in an August 1st Instagram message ahead of baby number 3's arrival, "With every ending comes a new beginning. I am so grateful to have shared this season with you. You have brought me more love, more life, and most of all, renewed my power, reminded me that I can have it all." She added, "You reminded me that I never have to choose between life, love, and my
Oh, I know people are disappointed. Listen, I went to the One Music Fest. Y'all know that Shador and I are in the Atlanta area. Last year I went, and Megan Thee Stallion was there performing, and Janet Jackson. I tried to lose my mind. I want to promise you that when she played Rhythm Nation, I busted out the entire move out there. You know that One Music Live is huge and it's outdoors. I did not care. Okay. And then she was playing, oh my gosh, every song. I was doing all the dance move from the videos back in the day. And you know, she did Pleasure Principle. All I needed was a chair so I could go flip over. But anyway, so I'm wishing Cardi B the best. You know, as they said, she didn't reveal any details. And what I love about Cardi B is that she really is transparent, right? Because she talked about how she got some of her butt shots removed. And for those of y'all who did not see that, if you go back to, I think a couple weeks ago, but if you go to my playlist here on this Dr. Frita YouTube channel and you go to lives, and you can just flip them down and look and see, you know, who you see in the thumbnails. And I know we talked about Cardi B, we talked about BBLs, butt shots, butt implants, things of that nature. I was also on Funky Dineva's channel you can see that also, where we talked about BBLs. But she did reveal that recently she had more of her butt shots removed. I don't know if that's her emergency. And maybe she'll share it with us. Maybe she won't. She doesn't have to. But I'm definitely hoping that she gets better, because I know she was going to be good. And she was probably going to do Don't Save Her. She don't want to be saved. Hey, maybe they can use me as a replacement. What do y'all think?
Yeah.
She would glow. No, don't quit my day job. All right, that's fine.
Don't quit your day job, Dr. Frita.
Don't do it. All right. Listen, even my mama likes Cardi B, and I hope she's watching right now. My mother, Dr. Inez, because she loves saying, "If I see you and I don't speak," and yes, my mother is very grown, but if I see you and she don't speak, that means okay. All right, so that's what's going on with her. So here's something else that's going on in your weekly dose of medicine in the news. McDonald's. Now, for those of y'all who have been watching my videos, y'all know I think we have like over 300 videos now on our channel. You know that I'm constantly talking about the types of foods to avoid, right? Foods with high salt, foods that have a high in saturated fats, right? Doing excessive amounts of red meat, fatty meat, marbled meats, things like that. A bunch of French fries, a bunch of carbs, a lot of bread. I talk about those things as foods to avoid for your health, for your cardiovascular health, to try to keep from having a whole lot of high blood pressure. Well, in fact, when you finish watching this live, check out the video that we just released last week. Yeah, we got a good video. So check it out right after you finish watching this live. Well, a lot of these foods can be found at McDonald's, and I'm not knocking what anyone does, but just make sure that you make choices that are good for you. If there's certain cravings that you have, hey, have fun, do things in moderation. But we know that a lot of foods at McDonald's tend to fit the description of high salt, highly processed foods. They do have salads as well. Let me go ahead and say that. They do have salads and some other choices. And we also saw that the former president was at McDonald's salting fries, okay? But anyway, McDonald's is in the news for more reasons than just him being there. There's been another outbreak, y'all. There's been an infection, E. coli. Let's roll that clip. McDonald's.
Tonight, new details in the E. coli outbreak rocking fast food giant McDonald's as the first lawsuit is filed. The CDC confirming the nearly 50 people infected range in age from 13 to 88, with 10 hospitalized and close to 20 stemming from one western Colorado county where officials say one person has died. Meanwhile, the CDC teaming up with the USDA and FDA, interviewing infected customers, examining beef used in the menu mainstay, the quarter pounder, and officials say the likely culprit, raw slivered onions.
Food safety is, our top priority at McDonald's.
McDonald's president this morning on Today stressing the company has pulled the quarter pounder and its onions from menus in affected states and fielding a question about where else those onions might be sold.
We're going to work closely with the CDC and work closely with our supplier I don't want to speculate where those other products might have gone.
The FDA declining to name the onion supplier. This after the CDC confirms they were first alerted to cases of E. coli in Colorado nearly 2 weeks ago, adding they flagged McDonald's a week later, though investigators didn't connect cases to the quarter pounder until the weekend, prompting it to be pulled.
Do you expect numbers to keep going up amid this outbreak?
We do expect the number of illnesses to go up. We think that's going to be driven by people who ate quarter pounders at McDonald's before they took these actions.
Customers watching what happens next.
I'm very frustrated because my kids like McDonald's.
Experts say McDonald's has a long road ahead, but note brands have bounced back from crises like these by prioritizing food safety and public transparency. Lester.
All right, man.
Oh boy. McDonald's, I tell you the truth. Well, they're right about the transparency. If you can tell the truth, tell us what you're doing, pulling the onions. It's interesting because we know a lot of times, Shador, that beef can be infected with bacteria like E. coli. They think it's actually the onions, right? And so you have some people who go to McDonald's and they don't eat meat and they might say, you know what, give me a burger with just the bread, lettuce, tomato, and some onions. And now we know that the onions have the E. coli. So I'll talk a little bit about E. coli infection. And it's true, you know, the McDonald's burgers in general, you know, high salt, high preservatives, things of that nature. You know, again, if you do things in moderation, that's your business. But in general, we know that McDonald's is a lot of the food, specifically the quarter pounder with cheese, which let me just tell you the truth. I've had quarter pounder with cheese, and yes, I like quarter pounders with cheese. Do I have it as a part of my staple of my diet? Absolutely not. And what I've never had in my whole life, Shador, is a Whopper. Look, in the chat, I want you to put quarter pounder or Big Mac versus Whopper. And no, I'm not promoting these. There are ways that you can have healthier burgers, like if you do like turkey meat and then you do lettuce instead of bread, right? Do lettuce wraps and lots of vegetables, right? Or you can even have a meat substitute or no meat at all. You can use black beans. Okay, so there are all kinds of healthy recipes for burgers. But I want you to put Whopper versus Big Mac is what we'll say. And then here's the real question. It's a trivia question. Add this to it. There is a rap song from decades ago, and one of the lines is, I like the Whopper, bleep the Big Mac. Who said that, and what's the name of the song? One of the lines in the rap song, I like the Whopper, bleep the Big Mac. Okay, all right, but back to E. coli. So E. coli is a bacteria that they found, and we know that E. coli is actually a bacteria that is found in our bodies on a normal situation. It's actually found in our intestines, okay? And while it's in our intestines, it doesn't bother us, okay? That's where it's supposed to be. That's part of the normal flora. But E. coli gets us into trouble when it slips out of the intestines and it goes other places where it has no business. So if E. coli gets into your urinary tract, it can cause a UTI, right? A urinary tract infection, or cystitis, or bladder infection. And E. coli, they really trip me out because if you see them under a microscope, and especially like an electronic microscope, you'll see that they have these little like leg-like projections. And with those legs they're not actually legs, but like little leg-like projections all around them, and they're sticky, and they can crawl up. They can crawl up your urethra, which is that urine hole, right, between the bladder and the outside world. They crawl up there. They can get to your bladder. They can crawl up your ureters, which are the tubes that connect your kidneys to your bladder, and they can get to your kidneys and cause pyelonephritis, and that's a mess, right? And so when the E. coli get into the urinary tract, they can cause urinary tract infections or even pyelonephritis. And also, if E. coli gets into your bloodstream, it can cause an E. coli sepsis or even a septic shock. And then in this case, when it gets into your gastrointestinal system, right, when you swallow it, and then it starts to multiply in huge amounts, right, it can make you very, very ill, and you can get a watery diarrhea. In some cases, people can even get a bloody diarrhea. Okay, so even though E. coli is a part of the normal flora, there are different types of E. coli. Oh, I remember E. coli 0157H7. That's one that was giving people food poisoning. Back in the day, it was in Jack in the Box. Ooh, we didn't have any of those where I was growing up. They did have some in Nashville, Tennessee, where I went to medical school at Meharry. I digress. But this is E. coli. McDonald's is doing what it's supposed to do by being transparent thus far. And so, they're not loving this right now. Do we have anybody participate in the games I like to play? Whopper versus And does anybody look? Y'all gonna age yourselves if you know this song. I like the Whopper, boop, the Big Mac. Anybody know who said that and what song?
Yes. So your members only have chimed in.
Hey,
Still
I want to
Pooh.
shout out to the members only. Who's in here? Who are my members?
Still Pooh.
Hi.
She said it takes two raw bass.
You got it. That used to be my song. Listen, y'all. I used to do the Alf, Cabbage Patch, Reebok. Oh, I like the. Okay, you got it. Anyway, all
Miss
right.
Glenda prefers the Whopper over the Big Mac or a quarter pounder.
Never had one. I don't like huge, just
Oh,
aesthetically.
Whopper Junior. I mean, you know.
Whopper Junior. I've had a Whopper Junior before. And again, I promote mostly plant-based, fruits, vegetables, things of that nature. Check out my video after you watch this live, 12 vegetables that are good for kidney repair and to help your body to detoxify. But since we're talking about McDonald's, I just wanted to mention it. And the goal for most people, according to the American Heart Association, is less than 1,500 milligrams of sodium a day. All right. Enough about McDonald's. So hopefully they will recover, because they provide a lot of jobs, as we know. And so it does affect our economy. And as long, these things can happen as long as they find the trouble spot and correct it. And as long as they're transparent, they give us the respect of being transparent, then I think that McDonald's will recover as well. All right. Can we talk about Solange, please? I want to talk about Solange because, one, I really like Solange. And of course, Solange is Beyonce's little sister, but she has her own name, Solange. She's done multiple albums. She's done acting, and she's ride or die for her sister. Y'all remember that elevator incident with Jay-Z? Okay, I'm not going to be messy. But now there was someone, Sean Ross, who's also a musician and an actor, and he was sharing that he has had long COVID and he developed POTS. Okay, he developed POTS. Postural orthostatic tachycardia syndrome. And Solange, who apparently is his friend, who knows him well, commented that she also has been diagnosed with POTS, as well as two other medical diagnoses, Sjogren's and MCAS. And so she was diagnosed back in 2018. And so let's just play this clip on Solange, and we'll talk a little bit more about her. Shared that she has been diagnosed with POTS, Sjogren's syndrome, and MCAS. I'm Dr. Frita, and here are 5 things to know about POTS. 1, POTS, or postural orthostatic tachycardia syndrome, is a condition that affects the autonomic nervous system, causing one to have a fast heart rate and fatigue after changing position or being in a warm environment or having physical exertion. Most people diagnosed are females between the ages of 15 and 50, but males can certainly be diagnosed as well. 2, symptoms may include dizziness or lightheadedness, forgetfulness or brain fog, shortness of breath, heart palpitations, chest pain, shakiness, nausea, difficulty sleeping, fatigue. 3, risk factors include viral illnesses like long COVID or mononucleosis. If you have an autoimmune disease like Sjogren's or lupus, you may be at risk. Also, pregnancy, physical trauma, surgery. 4, diagnosis. Patients often go months or years before being properly diagnosed, but it's diagnosed with a history in physical, blood tests, urine tests, and the tilt table test. 5, unfortunately, there's no cure at this time, but treatments may include diet and exercise regimens, wearing compression stockings, and even cardiac rehab. If you want me to do a video on Sjogren's or MCAS, leave a comment down below. Yeah, this one was a shocker to me, Shador, because Solange, first of all, I love when she and Beyonce actually performed together. Like, I believe when Beyonce did Super Bowl and Solange came out there with these white furry boots and platinum natural hair. And when I tell you Solange can dance, and I forgot she used to be one of the backup dancers, right, for Destiny Child. Solange can dance down to the ground, okay? And then when she was pregnant, and she was a young girl pregnant for that Soldier video, I need a soldier, something. I don't know. Dog, maybe I can't replace Cardi B at One Music Fest. Dog, I could try to be a backup dancer. But anyway, I digress. So, she was pregnant in that video. And I just like Solange. You know, she has her own little kind of eclectic style. But yeah, I thought that was pretty open of her. She's been living with this since 2018. And there have been things that she's canceled, like she was supposed to perform at Florida State's homecoming once, and she needed to cancel it due to some type of an autonomic disturbance. She wasn't specific at the time, but now it's all making sense, because if you have this POTS, which can be quite unpredictable, then you're performing, you can get a really fast heart rate, your blood pressure can drop, and physical exertion is one of the things that will trigger it. Okay, so that video, you can see that on my Instagram at dr.frita after you finish watching this live, and it'll give you more information on POTS. And as we get ready to go to the next topic, y'all can put some questions in. We'll see if we can handle a couple of questions here. But remember, to all of my members and to everyone who wants to be a member, after we finish this live, which I thank y'all for joining, I'm going to have a members only live where for the entire session, we're going to do questions and answers. So for all my members, once we disconnect here, go to get your notification to come for the members link. And if you're not a member, it's not too late to join. Just click the link in the description and join us, because what I do for the members only is that I have videos that are exclusive to members. And so throughout the week, different things that I'm thinking about going through, different medical topics that come up. Sometimes when I'm in the clinic, when Shador and I are in the clinic, I have a patient who inspires me just to kind of go talk about that experience and just give some different extra medical knowledge. And those videos are for members only. Also, my members get a first look, right? Before I release videos to everyone else, I give members first look for a lot of those videos. And then, of course, we have our monthly live Q&As where we just do Q&A, and the members and I go back and forth. We go back and forth. You can ask questions. You can ask follow-up. You can even come up to the stage and we'll talk. Only members will see those videos. They won't be released to everyone else. And of course, we have custom emojis, loyalty badges. Don't worry, if you're not a member, I'll keep giving you evidence-based medicine, both here and in my routine, regular YouTube videos. I'm not taking away from you. But if you want a few extra VIP perks and a couple, some extra time. And for those of you who are new, I mentioned that I'm a board certified kidney doctor and high blood pressure doctor, but I have also been board certified in internal medicine and pediatrics, because I did a dual residency at Georgetown University Hospital, Washington, D.C. And then afterwards, I went to Emory, where I completed my nephrology fellowship. So now I'm board certified in nephrology, or board certified kidney doctor. And I also most recently got my board certification in obesity medicine. So these live Q&As, it's not just me rapping and trying to be Cardi B or talking about my days and doing Janet Jackson dancing. I'm actually giving you real evidence-based information. I've got years of experience, more than I care to share. Ooh. So it can really be worth your while to have a chance to get my input on some medical topics. This is what I do. This is what I love. So yeah, click that link and go ahead and join our membership. And we'll do our live Q&A today. Hey. Okay. All right. So, so let's see. What shall we talk about now? So for Solange, I mentioned the POTS there, the postural orthostatic tachycardia syndrome. And a lot of people who have long COVID, okay, will get it. Or if you have other viral illnesses like mononucleosis, and literally we have autonomic nervous systems, right? Anytime we stand up, and you might notice if ever you stood up too fast or if you were a little dehydrated, sometimes you get a little lightheaded, right? Like, oh, wait, shoot. Okay. But it doesn't last for long if it does happen, because our autonomic nervous system kicks in and it causes our heart rate to increase, and it causes our blood vessels to tighten in order to pick our blood pressure back up and to get the blood flow to our brains. Because when you stand up, a percentage of your body pulls down to your lower extremities, right? And below the heart, making you lightheaded with a fast heart rate. But the epinephrine's released, adrenaline, norepinephrine, and hey, we're fine, okay? If you stand up a little fast. But if you have POTS, the postural orthostatic tachycardia syndrome, then your autonomic nervous system has a dysfunction. It's not working properly. And your heart will still react to the norepinephrine, the epinephrine, to those things. And so you get a fast heart rate, but unfortunately your blood vessels don't tighten. And so you still have a low blood pressure. So you've got this fast heart rate, you've got this low blood pressure, and that can make you pass out, okay? It can be triggered by physical exertion, like putting on a show, okay, which I can understand why Solange just had to cancel some. I know that hurts you when you're a performer. And she even said she didn't want to be defined by her illness, which I really understand, not wanting to be defined by your chronic illness. But sometimes you just have to respect your body and just listen. if you can't do certain things, right? But so it can cause that. And also it can be exacerbated by warm weather, like in a hot shower, Shador, people might notice that they get discolored hands and feet, like purplish hands and feet from that dilation that happens in the blood vessels. And it's pretty rough, okay, the POTS syndrome, because it can be pretty unpredictable. And unfortunately, there's not a cure. You know, people can wear compression tights, things of that nature, do cardiac rehab, exercise, diet. We don't have a set cure for it. So that's that on POTS. If you have any questions about her other syndromes like Sjogren's and the MCAS is mast cell activation syndrome. Oh, and actually, just this morning on my Instagram at dr.frita, I did a video on MCAS, one of her other syndromes. So after you finish watching this video, please go to Instagram, give me a follow, and watch that video. And if you have any questions, go ahead. We can get to some questions at the end of this Q&A right here on our regular live. But if you really want, to be able to have a long question and answer sessions with me, we have our members only Q&A. It's not too late. Click the link in the description. Join us. All right. So now let's talk about some of these Real Housewives of Atlanta, RHOA alums and their family members, because the alums are doing fine. NeNe Leakes and Kandi Burruss, it's the family members who've been giving them scares. So let's start off talking about NeNe Leakes. We know she has 2 sons. Her youngest son is Brent Leakes. We watched him grow up right in front of our eyes, those of you who watch Real Housewives of Atlanta. And what we learned is that he was actually diagnosed with congestive heart failure after having a stroke when he was only 23 years old. Okay, since then he's lost reportedly 100 pounds, and his congestive heart failure got to the point where he became eligible for a heart transplant. Literally, someone donated a heart to him. He's had that heart transplant. He had it this past summer at the age of 25, and now he's coming out and sharing his story. Brent Leakes, the son of NeNe Leakes. Let's roll that clip.
Shit. New heart. Got a new heart in. Shit.
All right. Do we have the clip of him walking? Do you have that easy access?
Sure do.
Okay. So we'll talk about heart transplant and congestive heart failure in the chat. If I could have y'all, if you could put what you think some risk factors might be for someone having congestive heart failure, because NeNe actually came out because people were speculating and started saying, "Ooh, does he have infections? Ooh, is he doing crack?" All this kind of stuff. So she had to come out and set the record straight, because those are not the only things that put you at risk for congestive heart failure. So in the chat, if you could put what you think a risk factor might be for having congestive heart failure, we'll touch on that real quickly as we move along.
All right, here's a link of him walking, Dr. Frita.
Okay, this is Brent walking after his heart transplant.
Let's do it.
See, you can.
You got it.
You know, my kid.
Good job. Good pace. Keep breathing.
Come on, bro.
You got this. You got this.
Come on.
In your nose, out your mouth. Good. Let's walk. You got this.
Okay, so he's up, moving around, walking, and I don't know his height, but I know that NeNe Leakes, I think she's my height, like 5'11", and he towers over her. Even when she has heels on, he's taller than she. So he's a big guy. So did anyone put any risk factors? I know I just asked that real quickly for congestive heart failure. Okay.
Yes, a couple went with diet. Love Jones.
Hello, Jones.
And Laverne. Hi, they both said diet.
That's right. So if you have a diet that's high in salt, high in saturated fats, that could put you at risk for having high cholesterol, which in and of itself is a risk for congestive heart failure. Good. And let me say what congestive heart failure is. It's basically when the heart stops pumping effectively and you get a backup of blood and fluid in your lower extremities, like your legs, your feet, your ankles, and your whole body. And you can get a backup in your lungs, causing a shortness of breath. And it's something, being over the age of 65 is a risk factor. Clearly, Brent was 25 at the time of his surgery, so he didn't have that risk factor. Anyone else with any risk factors?
No.
Okay, so some other risk factors are crack and cocaine use. NeNe was very clear to say, don't even do it. My son does not do drugs. Another risk for congestive heart failure is excessive alcohol use. Okay, you can get a dilated cardiomyopathy due to overuse of alcohol. And she said that her son didn't drink, her son didn't do those things. So she kind of came out to kind of get everybody together who was speculating as far as his causes. Ischemic heart disease is a big cause, okay? So if you have coronary arteries that are narrowed, usually due to plaques, okay? And again, having high cholesterol can put you at risk. Living with obesity. Now, he definitely was living with obesity, no question about that. Living with obesity can put you at risk for congestive heart failure. Also, having a sedentary lifestyle can put you at risk. Certain infections like HIV, okay, there's an HIV cardiomyopathy, which can lead to congestive heart failure. And even Coxsackie virus, that's another virus that can pretty commonly cause a myocarditis and a cardiomyopathy. So those are just a few of the things that can put you at risk. Having valvular heart disease, okay, like if you have mitral valve stenosis, aortic valve stenosis, mitral valve regurgitations. You may have heard of some of these things. Some of y'all might have them. Oh, shoot. Okay, make sure you keep up with your cardiologist to see if you are someone who's a candidate for a valve replacement. That's a real thing, because having valvular heart disease can lead to congestive heart failure. Okay, and for him, his congestive heart failure got to the point where he needed a heart transplant. There are other treatments, typically things like diuretics or water pills, right? Furosemide, Lasix, spironolactone, ACE inhibitors, like lisinopril, certain beta blockers like metoprolol, Coreg, or Carvedilol. These are some of the medication treatments that are often used. And some people even need VADs, or ventricular assist devices. I could go on and on and on and on, but I won't. But I will tell you, when you finish watching this live, I do have a couple videos. I have videos on congestive heart failure explained, okay? Because it's really important to pick up on the symptoms. And then I actually, if you check out my Instagram at dr.frita, I did a video talking about congestive heart failure. If you want it in a short form content, I go into detail. So go ahead and check that out. All right, let's quickly talk about candy as we get ready to move to the end. We'll do a couple questions, quick questions here, but then right after this, we're going to do our members only Q&A, where we could just take our time and do our questions and answers. Okay, Candy Burris, another Real Housewives of Atlanta alum. She had the longest running history on the Real Housewives of Atlanta. I think it was like 14 years, but her husband, Todd Tucker, had a scare. They were at a Broadway show, apparently, and he didn't know if he was having a stroke. He didn't know if he was having a heart attack. He said his blood pressure was up, but thankfully they did go to the doctor. Everything was okay with him as far as him not having like an acute heart attack or a stroke. But let's see, let's play that clip or see if we have a article on Kenny Burris's husband, Todd Tucker.
At Boulevard, dope Broadway play. My blood pressure was high yesterday, like really high. And I started feeling like chest pains and like a numbness in my left arm. You know, I tried to ignore it. You know what I mean? Like, you know how men do, man. We just try to be like, man, it's all right. It'll go away. It'll go away. So I felt it throughout the play. After the play, it was just kind of really bothering me. But I kept going. Went to the little after event. We went to dinner. And some friends that was with us noticed that I kept rubbing my arm and stuff like that. And they asked me what was the problem. And I told them. And they just instantly called 911. You know, a lot of times, man, we think we all right. And we just kind of like, oh, I'm going to be cool. And, you know, what's up, y'all?
Yeah. So I'm glad he shared. Okay. I'm glad he shared, because especially with a lot of us who are getting grown or getting less young, you know, you might still look cool. You might still feel cool. But when you're over 40, there are certain, you're a new risk category, right? You're in a new risk category for strokes, for heart disease. And heart disease is the #1 cause of death in this country, plain and simple. And so he's sitting up there, he's having the arm pain. And we know that some of the symptoms of heart attacks will be, you know, left arm pain, left jaw pain, bilateral arm pain or tingling, both arms. You know, it's not always just the crushing chest in the middle of the heart. You can have nausea, you can have vomiting, you know, you can even have back pain. There's all kinds of things, but just pay attention to your body. You know when something is off, okay? Don't worry about ruining the night. Don't worry about ruining the Broadway play. And I'm glad that the people who were with him didn't play with him and they called 911, okay? Same thing with a stroke. And, you know, look, I have a ton of videos on here talking about strokes, talking about some of the symptoms of stroke. So you all will be able to check those things out. Thankfully, he didn't have those things, but time is muscle, as in heart muscle, right? And time is brain. So for every minute that you wait, if you're not getting proper blood flow to your brain or to your heart, you're putting yourself at risk, not only for not being alive, but for having some type of a permanent brain damage. And so prioritize yourself. I don't care if you ruin the night, mess up whatever's going on. activate EMS, call 911 if you're having symptoms, and we know that with strokes, we're talking about like be fast if you're having blurry vision, right? Or if you're having a facial drooping or an arm drooping, if you're having slurred speech, it's time to call 911. Okay. So if you're having balance issues or eye problems, all those things, time to call 911. Okay. So I'm glad that he's doing well, Todd. Okay. Because look, they got those kids to the house, they got those businesses. He needs to stay around, he needs to be around. So yeah, I like Todd. All right. So let's get into this last story before we close out. And then we do a quick Q&A. Listen, if you want to ask me any questions where never mind a group, you want to just do one-on-one, then make sure you click the link in my description because I have a concierge service, okay, where you can do telehealth with me. We'll take plenty of time. I'll do a history and physical with just you one-on-one. And we've been having really good success, and wherever you are in the world, you can connect with me on this telehealth concierge service, one-on-one history. And I can talk to you. I can give you second opinion, first opinion, give you some insight into your medical condition. So make sure you click that link in the description. Okay. And then we know for what Todd was talking about, being scared of having a heart attack, being scared of having a stroke. We know that high blood pressure is a big risk factor. Please check out my book. We'll have the link in the description, but also you can go to Amazon or to my website, dr.frita.com, Under Pressure, A Guide to Controlling High Blood Pressure, where I talk about not just Western medicine, but also talk about using food as medicine, lifestyle as medicine, exercise as medicine, all the things in this book. I'm very proud of it. It's doing very well, actually, and it's helping a lot of people. So check that out. All right, so now let's move into our last story, and they'll be wrapping up pretty soon. Let's talk about Oprah. Oprah, you get a car. Look, if I can't go to One Music Live with my music, maybe I could do Oprah impersonation. I don't know. Or keep the day job and just be a doctor. All right, let's talk about Oprah. She's talking about menopause. Let's roll that beautiful bean footage, Shador.
All right. 48 with heart palpitations. And I went from doctor to doctor, literally 5 different doctors. At one point, female doctor had given me first of all, an angiogram and put me on heart medication and had never once mentioned that this could be menopause or perimenopausal. And I just happened to be in the office one day and opened a book and saw heart palpitations, symptoms of perimenopause. I remember going through a period where I just felt like, whatever, and could not concentrate reading, which is my favorite thing to do, my love. I couldn't focus long enough. And a friend who was going through it said, do you find yourself not concentrating? And I was like, yeah. You feel that you're duller than you used to be? Yeah. And I'm telling you, when I went and got my first click of estrogen, it was because I used a little click, I got my first click and I was like, the sky is bluer.
Oh my goodness. Yeah, I love how transparent Oprah is. So yeah, menopause. And listen, shout out to my family member. I was talking to her on the phone this morning. I won't put her business out there on Front Street, but we were talking about menopause symptoms, perimenopausal symptoms, and how she was learning that kind of not being able to focus, things of that. She thought that maybe she had ADHD because we talked about women, now at later ages or as adults being diagnosed with ADHD, but that doggone menopause is like the great imitator. And we know that menopause is when you have not had your period or your menstruation for at least 12 months. And then perimenopause can be in the years, it can be up to 7 years, child, leading up to that point of actual menopause. We can get irregular periods and you can have a lack of focus, inability to concentrate. You can have chest pain. You can have heart palpitations. You can have problems during intercourse. Okay. And back, I think one of the first few lives that we did, we talked about Halle Berry, whose doctor said that she had the worst case of herpes he'd ever seen. He told that lie, lies you tell. She did not have herpes at all, Halle Berry, but in fact, she's perimenopausal. She just had vaginal dryness and causing her to have some erosions basically during her intercourse. Child, but menopause can do that too. And of course, it can cause hot flashes or personal summers. It can cause that vasomotor irritation. And so make sure you consult with your doctor and find out the best way to treat your menopause, your perimenopausal symptoms. Oprah is doing estrogen. Estrogen is not without its risks. You want to talk about all of the risks of estrogen and hormone replacement therapy. You also want to talk and see if there's any kind of natural remedies or even some certain medications like some selective serotonin reuptake inhibitor, certain antidepressant, anti-anxiety medicines can help with menopause symptoms. So make sure you check that out. All right, it looks like it's time for us to about wrap up. I will take just 1 or 2 questions from here, and then we'll go over to our members only live Q&A. If we have any questions, do we have any? Going once, going twice.
Yes, of course, Dr. Frita. We have a couple of questions. Nice try. All right, so we'll start with Love Jones.
I love doing the live Q&As. Okay, who is this? Who is this?
Love Jones.
I gotta Love Jones. Oh, hey, Love Jones. What's the question?
Is POTS contagious?
POTS is not contagious. Thank you for asking. So yes, postural orthostatic tachycardia syndrome. It's actually literally just a dysfunction in your nervous system, in your autonomic nervous system. So even though I did mention that a risk factor can be if you have an infection, like if you're suffering with long COVID, or if you've had mononucleosis or other viral infections, that can put you at risk for getting POTS, but POTS in and of itself is not contagious. Yeah.
All right, thank you. This comes from Fahim.
What's the name?
Fahim.
Hi, Fahim.
How does E. coli get up the urethra?
Baby, let me answer that question because as a kidney doctor, I see it quite a bit. So let's talk a little bit about anatomy. All right. You have, so down low, like kind of where your bladder is in the low part of your abdomen. Okay. Right in the front is the bladder. Okay. And in women, right behind that is the uterus, okay, or the womb. And then in women, right behind that is the rectum, okay? And they're all kind of lined up. So in men, right in the front is the bladder, and then behind is the rectum. So you can imagine for women, because it's normal for E. coli to be in the intestines, just part of the flora, you might just have E. coli kind of down in that area, right? In the perineum, like around the rectum, the vagina, right where the urethra is. It's just going to kind of be there sometimes. So if you are a woman and say you don't necessarily, if you don't wipe from front to back, as young ladies are taught, and say you wipe from back to front, meaning you use the restroom and you wipe yourself from your anus up to the front, well, guess what? You're dragging E. coli from the back to the front where that urethra is. And I told you, they have these little sticky little projections and they like to crawl up. Well, with women, think about the female's anatomy, okay? People born female. There's not much distance from the outside world to the bladder, right? With women, there's a short little distance to crawl up the urine tube or the urethra to the bladder. And so for women, it's quite common for them to get urinary tract infections. Also, if we may continue to be blunt and candid, but baby, this is evidence-based, there's something called honeymoon cystitis. Okay? What is that? Well, that's after being intimate, having intercourse. Okay, if you're in honeymoon phase, we'll say, and if you're a female, you've had intercourse where, hey, all kinds of body fluids are moving about, okay, and you're just sitting there and you're gazing into your loved one's eyes. Well, guess what? During that time, some of the bacteria that can happen when fluids are exchanging can crawl right up your urethra, including E. coli. And so that's how it can get from where it belongs in the intestine area to where it doesn't belong in the urethra and urinary tract infection. Yes, men can get it also, but again, let's take a moment and think about a male's anatomy, right? A male's anatomy, a male's genitalia. Even if he does have a man, someone born male, even if there is E. coli, kind of around the area, because of course they have it too, we all have E. coli, it's going to take that bacteria a much longer journey to get all the way to the end of a man's anatomy, okay? And then to get through his urethra, his urine hole, it's got to crawl all the way up the male genitalia, okay? And by the time it tries to make it to the bladder, he very likely would have urinated and bye-bye E. coli, you don't have a chance. That's why these things happen much more commonly in women with female anatomy versus a male with male anatomy. Okay, I hope that makes sense. But for women, one way to avoid honeymoon cystitis, okay, is to, instead of basking in the love and the glow after you've been intimate, as soon as you're intimate, get up and go use the restroom, okay? Urinate to get that E. coli out of your system, okay? And yes, I recommend that you wipe from front to back. That way you're not dragging E. coli from the Netherlands up to your urethra. Instead, your nice sterile urine is what's going to be pulled back to where the E. coli is. All right.
All right. One last question, Dr. Frita. Thank
you.
Okay. It's come from T Chosen One. Hello.
T Chosen One. Thank you for joining us again. Love it when you join us.
So if ANA blood testing don't necessarily pinpoint certain autoimmune conditions, how is a person diagnosed, and does the illness go into remission?
Oh, baby. T Chosen One. This is going to require a long answer. I'm just going to give you what time? Oh, wow. I'm gonna give you a Cliff Notes version. Okay, so you mentioned ANA, anti-nuclear antibody, and that's the screening test for autoimmune disease, right? And we know that autoimmune diseases are diseases that attack yourself. The same way that an autobiography is a book that one writes about oneself, an autoimmune disease is when one's immune system attacks oneself, right? So we've got lupus, Sjogren's, rheumatoid arthritis, sarcoidosis, all these illnesses where your antibodies are attacking you. So the ANA is the screening test, right? And if you have any one of these illnesses, then your ANA might be positive, but it's not specific, right? So if you do a double-stranded DNA and it's positive, then likely you have lupus, right? And then there's specific Sjogren's tests, and then there's rheumatoid factor for rheumatoid arthritis. So if your ANA is positive, then I recommend that you talk to your primary care doctor about doing some more specific testing, or your primary care doctor may even refer you to a rheumatologist, and that's going to be the way that you get the diagnosis. Now, can some of these things be in remission, some of these illnesses be in remission? Absolutely. Absolutely. The lupus can be waxing and waning. The rheumatoid arthritis, it can also be waxing and waning, meaning it comes and goes. And we have different people who've been really open, like Toni Braxton will share. She's had pericarditis with her. She's had all kinds of issues, and it's up and down, okay? Where sometimes she might not have the energy to perform the way that she wants to. We know that Selena Gomez, who's had a kidney transplant because she had lupus nephritis, she'll talk about how the lupus symptoms can be up and down. So, but my best recommendation, if you had a positive ANA, ask your doctor to do the specific testing. Do I have lupus? Do I have Sjogren's? Do I have scleroderma? Do I have rheumatoid arthritis? And your primary may be able to get the testing started. But if you still have questions, I would see a rheumatologist. Okay, that's like a lupus specialist or an autoimmune disease specialist. And in some cases, it might just be your ANA that's positive and nothing else specific is there. But if you have a positive ANA, it lets you know that perhaps you'll never have an issue, or there could be some type of an autoimmune disease looming in the background. All right. I wish you the best. She chose one. Thank you for that question. And I do have some videos here where I'm talking about lupus explained. Yeah, so check out some of my videos here. All right.
Shout out to our new member, Miss Kim Luder.
Hi, Miss Kim. Oh, I hope, can you join us? Listen, we're going to click off here and we're going to go right to your members only link, and we're going to do a live Q&A so we could chat. So I hope you can stay with us today. And even for those members who can't stay for the live Q&A, you will have access. It's a members only access, but if you're a member, you will have access to our live Q&A. All right. Thank you for joining. I appreciate you.
All right. Thank you, Dr. Frita.
All right. So thank y'all. We will see you next Monday for another Medical Monday. We'll do more myth versus facts. And of course, I'll always give you your weekly dose of all of the hot health topics in the headlines. All right. See y'all next time.